and Director of Clinical Services, UBT. You are welcome, sir. Then, please, round of applause for him. Then we also have Professor Sonny Okegweme, Professor of Community and Preventive Dentistry, University of Benin, and University of Benin Teaching Hospital. You are welcome, sir. Also, we have Dr. Adaze Enogieru. He is currently the Assistant Dean of the School of Basic Medical Sciences, University of Benin. You are very welcome, sir. And then finally, we have Dr. Omosigo Izedome, who is the Executive Secretary, Edo State Primary Healthcare Development Agency. He is ably represented today by Dr. F.A. Esegbe. Okay. He is the Director of Disease Control and Immunization at the Edo State Primary Healthcare Development Agency. He's my classmate. Welcome. So I'll now hand over to the chair of the session to carry on with the business of the day. Thank you, sir.
Thank you, MC, for that brief introduction. We are all aware that we are having challenges with looking after good professionals outside the shores of this country. There may be methods or ways to make them to stay, or for those that have left, what can we do to make them to visiting us often, to coming around? That may be what we call brain gain. They go abroad, get some skills, to come back and affect the system positively. So we have very seasoned discussants that will be taking this topic, discussing the strategies for retaining and attracting healthcare professionals in the present circumstance we find ourselves in Nigeria today. We are following the format of the names, the way we have it. I'm going to start with Professor Stanley Okubo. What strategies do you feel we can put in place to retain healthcare professionals in Nigeria? Thank you.
Good morning, professors and other persons present here. I'll just go quickly to the topic at hand which we are discussing. I think the very first perspective that we all should look at it is not that people are just there, so many of them, and they're just leaving. I think the very first challenge we have is that we are not even taking people before we even talk about retaining them. If you look at the University of Benin, for instance, in the last 5 years, how many lecturers have been employed? If you look at UBT, it's the same. We have a big challenge in terms of employment. I can tell from the University of Benin Teaching Hospital how challenging it is for us to even take in the first place before we talk about even retaining persons. Some of the things because of some official reasons, and they don't bring them out here. But we have had to do things that are not in the books, just so that we can even take people. Just to take. Because as it stands, in the last 8 years or more, there has been a complete ban on employment across board. So, first of all, we are not taking people before we even talk about whether we are retaining the ones that are there. First of all, government needs to start opening up, to start taking people. And that's a big elephant in the room first. I remember that last year, before the exit of the last administration, I was opportune to write a speech for the former Minister of Health. And I remember when we brought up the issue of this 1-for-1 And when we sold it to the ministry and we sold it to my boss, we all discussed it and then we said, okay, 1 for 1 is a good idea. A lot of those things, we encapsulated it in that speech. And I can tell you that many things that happen with government, that thing was not thought through completely until now the ARV strike came up. First of all, we need to take people. Secondly, how do we retain them? There are big issues. Number one is the remuneration. Remuneration is very poor. So much so that we have so many medical lecturers, clinical lecturers who are serving in the hospital presently who don't want to take appointment in the university because their salary will drop. So we need to address that. And lastly, sir, we need to ensure that people are able to practice their crafts the way they want to, the way they are trained to. And these are very simple measures. And I thank God for what was presented yesterday, the RADA, RATHER, that was presented by our keynote address speaker. Maybe I should stop here now.
Thank you very much, Professor Okubo. I'm going to ask Professor Okubo to speak to this. You are widely traveled. What do you think we can do to attract some of our healthcare professionals who are less leisure to this country to come back or be visiting regularly?
Thank you very much, Mr. Chairman, and the distinguished audience. I'm very happy to be here to contribute to this challenge. Okay, when you think about what actually made people to go away first, let us recap. I'll just quickly point out a few of them. In my mind, in my opinion, insecurity is one of it. And poor remuneration, as we said, poor funding of the health sector. To some extent, there are some other issues that have to do with lack of opportunities, to really exercise yourself. Now, when you go outside this country, automatically you will see opportunities. You will see citizenship of those countries, especially in the developed world. Many of them are committed to their countries as citizens because the country takes care of them, the country protects them, and you can see the country taking the health of the citizens very, very seriously. When you come here, it's almost the opposite. Things appear to be disorganized. Things appear to be, not clear. And the division is very, very visible. People are divided across many lines, ethnic lines, and so many things. All these factors, you will not be able to have peace of mind to be able to achieve what you want to achieve. So, you may just want to go to a place where you can have your peace of mind. And trying to make them come back here to come and be. One of the problems they usually say is this insecurity problem. And it's increasing. Kidnapping, armed robbery, even other things like bad roads, lack of electricity, lack of basic amenities, water, sanitation, everywhere is disorganized. All these things, some people cannot take it, and that's one of the reasons that they feel that they cannot come. Maybe as time goes on, we'll look at some other issues.
Thank you. It's talking about the push factors. The push factors and the pull factors. There are better pay across over there, poor remuneration here, insecurity. To Dr. Agaze Ilunjeru, you teach anatomy when they're just starting the program. And that things will be inculcated there at that level that may probably convince them to stay when they finish the program. And two, can you speak to this issue of security? Can we continue like this? We just keep losing them for these reasons? What do you think can be done to reverse the trend? Thank you.
Thank you, my Prof. Chairman, and
all protocols duly observed. And the truth is, in a college conference like this, factors that is not really looked at is the fact that, one, there's a lack of job satisfaction. Two is that there's I would call it an intersector crisis. And three, an environment that is not safe. Why do I say that? It is because I was very happy to be here this morning when Professor Kunufa was talking about that the training of healthcare professionals has to be multidisciplinary. Okay, I can tell how many of my colleagues who necessarily would not have probably left, but because of the infighting, the crisis in the school, in the basic medical sciences, that's pushed them away. Okay, where there's this push now to say only doctors have to train only doctors, and only basic medical scientists have to train basic medical scientists. I was among the first set of basic medical scientists that were trained in this university, and our training was not like this because we were trained like both doctors and non-doctors with a very healthy mix. Okay, but preaching now about, because there are so many skills. While we're talking about telemedicine and the use of artificial intelligence, there are so many skills that someone with a graduate of maybe a BSc physiology or a graduate of a medical biochemistry, there are so many skills that with acquiring higher degrees, an MSc, a PhD, that will benefit even the healthcare, the core healthcare professionals, like the doctors, the nurses, and every other, the med lab scientists. But with this new push for limiting the training of sciences, I don't think that negates all we have been led here to say that it has to have a multidisciplinary approach. But when these things have changed, when we find out that competence, because there have been several lecturer assessments in the School of Medical Sciences, for instance, and these lecturer assessments, students assess their lecturers, and you will find out that there is no particular trend to say doctors teach better than non-doctors or non-doctors teach better than doctors. Okay, but when there's a healthy environment, I did my PhD in Cape Town. The next door neighbor to my supervisor was a medical doctor, and my supervisor was a non-medical. They work together, training medical data and bringing out healthy output. So one of the push factors for non-medics who are working in and training these healthcare professionals is the fact that, one, there's a lack of job satisfaction. Two, there is also an environment that is not healthy, that actually makes them say, okay, you know what, I think my services are needed better elsewhere, and all of them leave the system. So there has to be regulations that create a healthy mix of individuals to target and deliver this multidisciplinary approach to the development of healthcare professionals. Thank you. Dr. Segbe, you work in government and administrator. What do you think the government can do to reverse this ugly trend?
Okay, thank you, Mr. Chairman, sir, and distinguished panelists. First, I would like to bring greetings from my boss, the Executive Secretary, who is unavoidably absent today. He asked me to apologize on his behalf profusely. To your question, sir, one of the main push factors that the CMAC referred to had to do with remuneration, and that's a major push factor. And we are aware that government cannot do it alone. Beyond those in the government circles, we also need to look at providing enabling factors for private medical practice to thrive and to thrive well. Because if you look outside this country, most of the very large health institutions are not government owned, they are privately run. So if we can influence policies such as reducing taxation on medical equipment coming into the country, reducing taxation on health facilities, that may encourage some people to be able to, either as individuals or come together as groups, to establish thriving medical practice that will remain in this country. I was just speaking with a colleague a while ago, and I said as of 2008, I think the pay for house visitors was almost equivalent to $1,000. But I don't know if even senior doctors earn $1,000 today. So that has reduced the economic power of doctors generally, and it will continue to push for doctors' migration to greener pastures. Then secondly, we'll also look at government strengthening health insurance, because health insurance is a way that a lot of funds can come into the health sector, so that both patients don't have to pay out of their pocket for every medical intervention and spend in a way that it causes poverty for them. And then there's a pool of funds to fund health education, to fund remuneration, to fund the deployment of latest medical equipment. So if we have health insurance working as it should, we've had the NHIS for a couple of years now. They have not shown that it has worked very well. But we also have the Edo State Health Insurance Scheme, where all the staff of the Edo State government are registered, and we have even poor and low and middle income earners registered, so that they don't have financial difficulties in accessing healthcare, and then health facilities are getting enough funds to be able to run as they should run, and then they have funds to pay the health workers. Then we also come quickly to the flexibility, workplace flexibility. I know a couple of our colleagues who have migrated out of this country, they've signified interest in telemedicine, and the state government has tried to develop a telemedicine platform where both doctors outside rural areas and outside the country can interact with clients and provide expertise to review cases in the PHCs and ensure that those that require referrals are referred early. So if some of our colleagues who are taking their expertise out of the country, if they are worried about the security situation, the remuneration, one of the ways that they can also provide care for our people back here at home is by the use of telemedicine and other internet assisted medical services. Thank you, sir.
Thank you for your presentation. We are going to go around 2 minutes so that we can take 3 comments from the audience. Now, Professor Kubo will speak to what he just talked about. That's the next question. Telemedicine. How can we network with people that have left so that we don't lose their skills completely? Professor Kubo, how the workability, how we can be in touch with them so we don't lose them completely?
Yeah, now, first of all, before I just talk about telemedicine, look at the whole gamut of it first, so it makes sense, put it in perspective. What I would like to know is many of our people in diaspora are coming back. Many of them are coming back as individuals, going to private hospitals. Some of them are pulling patients. They come to Lagos once in a month or 2 months. They're doing specialized services, whether it's vascular, cardiac, neuro, or the rest. They're already doing that. Now, the point now is how do we harness that and make that more visible and more useful? We must remember that medicine is a business. The challenge is that we have always taken it as a social service only, and government can't fund it. Unfortunately, insurance has not helped at all. Now, I know, for instance, DPTH last year, insurance were owing us 1.2 billion. And this amount, more than 80% of them are money that DPTH spends. It's not just for service. So insurance is not helping. And if you look at penetration of insurance penetration in Nigeria is about 5% or 10%. That's low. So the indices are not very good, but medicine is a business. We must really understand it. All over the world, the biggest hospitals are privately run or NHI is run. Unfortunately, we have not been able to grab that. As a hospital, we have been trying. We have a lot of our diaspora people who are very useful to us, whether it's in pediatrics. We have some of them now. We are trying to engage them as consultants. We are giving them letters to work in UBTH as consultants. The only drawback is that we can't afford to pay them, like you mentioned. 2016, when the former government came in, $1 was 167. $10,000 was 1.6 million. Not so many of our people did not leave the country. Nobody wanted to leave. You go to Saudi and they pay $8,000. It's less than 1.3 million. Nobody wanted to leave. But today, $10,000 is over 9 million. So we can't run away from it. We must look at it and put it in context. I think by next month, in October, we are having some persons coming from Scotland to come and look at urology surgeries, specialized surgeries. Well, these diaspora people are ready and they are not coming cheap. Tickets, they are going to have all sorts of things. We need to have a way to remunerate them. There are many of them that are like angel donors. They are coming here to give their services free. They are sponsoring themselves. They are bringing consumables. But it's not a sustainable model. We need to therefore ensure that medical services are paid for. And one of the easiest ways to pay for them is to get insurance to become responsive and insurance coverage to improve. Because otherwise, the cost of care is astronomical with the economic downturn, and we need to have a sustainable model. We cannot have a situation where, yes, medicine and education is a social service, but that social service must be run as a business, just like they're doing in Europe and America. We must get insurance and other persons to fund it as a business. Yes, it must be taken as a social service, but it must be run and function as a business. That's the only way we can have a future for it. But lastly, I must say this in hope, sir. I remember as a medical student in this university, practically most of my lecturers had left. I there was Professor Ulrich, and people like Professor Dejuma and Quera used to come in on every 3 months or 4 months and give us some lectures in the evening. We are having some of those things, those kind of things. It was really bad in that time. I remember as a medical doctor, you couldn't, Prof, you may remember, you can't even buy a black and white TV with your salary. But things change. And I believe they will change again because all of these things go in circles. But in the way they change, and we're looking at perspective, we must now look and prefer solutions that make sense. And one of the solutions, I think, long-term solutions is to look at how healthcare financing and healthcare funding should be done in a way to be sustainable. And then we must look at how the social services and amenities around doctors and all the rest works. One of those things, some of our social amenities, housing and all the rest, even if we have to come together as a group or as associations or as pressure groups to get affordable housing and education. These are some of the things that may end up allowing people who want to remain and continue to give practice. I think those are some of these very important things. Yes, we may do many of the things we are doing creatively, getting these people, giving them letters as honorary consultants to come and lecture, to come and teach, to come and interface in our surgical practice and all the rest. But long term, sir, we must go back to medicine as a business and maybe incorporate it in our education. Thank you.
Thank you very much. Thank you for that presentation. Professor Okegwene, your comments on this. You talked about government not giving approval for one-to-one replacement. How can we address that? That's a major challenge. Somebody finishes a very difficult fellowship program, he waits for 1 year, and he has the opportunity, he leaves. That's another issue. So can you speak to that? What will be done?
Thank you very much. The government actually gave an answer to that question that you're asking. He said there's abuse of the waiver given for the replacement by the CEOs of that they are doing waiver. Actually, like who said, there has been an embargo on employment for many years now. They are not employed at all. There's embargo. But from time to time, they give waiver when there are critical, situation where you need to employ. And what the government is actually saying that there are abuse of those waivers, that such leaders either they overdo it or they do it in such a way that it doesn't follow the federal character anymore. That they begin to bring in their wives, their people of their ethnic group and distorts that. So that is one reason why that's the reason the government did. But what I can say is we need to look at data and see what actually is happening, who left and who should be replaced. And these things should be collated and well documented and well presented to the government so that it will work. I have a discussion with the President Registrar of Medical and Dental Council because we have this issue with the house officers when we have problem with house officers. He said that they request and proposal that all house officers now should be centrally deployed for the Medical and Dental Council. And they don't create a website, you apply from there and you deploy to wherever they want to go to. And for a couple of years now, we've had peace in that kind of in that system. So I think when we work together, when we use data and present them and give the impression of transparency and honesty, we can be able to address this one-on-one replacement. Thank you.
Thank you very much. Jerry, again, I come to you as somebody in the basic medical sciences. When they leave also, there are consequences. I have a friend who once told me he left to Saudi those days. When he came back, the children became rich brats. And he said, one regret I have is that the soul of a lion was eating grass. Because his own was medical school, was withdrawn from medical school. When the primary school had issue was withdrawn from medicine and had issues. So can we possibly use that from that formative stage to discourage this urge to want to go abroad? And again, I'm telling you, some places go there, they are not really doing too well. Some do not want to come home because of the shame. I want to go for 5 years. What will I tell them? Some are doing well, no doubt. So can we use that to open the door? Let them know from the also. Not everything, but I just go there. Not everything like that is good.
Thank you, Paul. I think it's beyond. I think it's beyond us really, because for instance, when I look at our staff list in the School of Basic Medical Sciences, I see that we are almost in a crisis, because apart from those that have left, those that have informally told me that they are leaving are even more than those that have left. because the truth is, all of these factors, especially the push factors, they are all talent. But what I spoke to proud to now is what we can do on our own, because majority of these issues, like Prof has said, they are all government based. We on our own, we most likely not be able to increase our remuneration, okay? And we also have to look at it from the point that even if we begin to tell these students that, okay, the country is going to get better and all of that, like they say where students are now, they will say, you go explain tire, no evidence. Okay? So you will explain to the students that, okay, the country now, you don't worry to get better, but there's no evidence on that. But on our own, as teachers and as trainers of healthcare professionals, all we have to do is to always conscientize them and appeal to their conscience that, like the keynote speaker said yesterday, it is sad that the country will train healthcare professionals who are training them to be exploited. Really, that is the way it is now. So we, people in management, I'm happy that My prof is close to the chairman of the medical advisory committee. He's up there. He can speak to management. If there's anything the university and teaching hospitals can do on their own, if for instance, use IGR to track some of the staff here, I'm sure many people will know what to do. Okay, sometimes we say yes, the government has to be the ones to shoulder, chest everything, but within ourselves. If I could tell you, in the University of Benin recently, I think our very capable vice chancellor gave a 10,000 naira palliative last month. If I tell you the extent that 10,000 naira went to some staff on ground, so it's not. Sometimes it's not how we do it, but something that encourages staff to say yes, this effort that I'm putting in is being appreciated. We go a long way to make
so if you know them,
someone decide whether he wants to
one gets it by now
or
meet her.
Thank you.
Thank you.
Thank you. Again, I will take that picture to the government. What can God do to encourage those who are staying behind? And two, for those that are staying behind, being overworked, what can be the cutoff? The man was stealing for money if that in itself can discourage the person from lose time. They are stealing for money in the evening. If a soldier, for example, makes a mistake during surgery because he was exhausted, how will you all look at it?
Alright, thank you, sir. So, I think that human resource and health professionals generally need to be recruited in sufficient number so as not to create a burnout amongst those who are currently there. And many times governments may not just do what is good and useful by themselves. I think looking back at the medical professionals, we need to have strong lobby groups, and we need to have some of us in politics ourselves so that the correct policies we are thinking about, we can ensure that those policies are adopted by government and implemented. Because when you're the one, they say that the mother of the child of the mother that cooks the food doesn't go hungry. When we are outside there just reading out policies that we think will make things better, they may not get done. A lot of us have witnessed where the National Assembly pay themselves huge sums of money. So but if we have strong lobby groups, we have our professionals as politicians, I'm sure we'll be able to push some of these policies to see the light of day. And then I also want to say that, like Prof said, it's important that as part of the medical curriculum that medical entrepreneurship and business management should be taught younger, because they just have the mindset right now that they don't even want to think of staying back in the country. They just want to graduate and just leave. So we need to reorient them by teaching them medical entrepreneurship. They can get a lot of money in this country from medical entrepreneurship and proper business management. Thank you.
Thank you very much. Because we are running out of time, I want Professor Matthias and Mopait in a minute or two wrap up a summary of the presentation. Then we'll probably take 2 or 3 comments and we'll wrap up the session.
Thank you very much. Well, we asked a question initially. We are saying that Professor Okubo said that government itself is not employing, talk less of retaining. It means that there is a lack, no employment of staff. And to start with, government need to employ personnel, healthcare personnel. They are everywhere. They should do the needful. Also, government need to increase the remuneration of staff. Currently, it is very, very bad. If we compare based on foreign exchange, it is, I think, Nigeria, we should be one of the poorest paid healthcare professionals all over the world. I don't have the statistics, but should be close to that. Also, he said that professionals should be given the free hands to practice their profession. And Professor Okebreme will ask the question, what should be done to attract diaspora professionals? did not actually address it, but he looked at the factors responsible for going away. And he said job insecurity is one of them, insecurity in the land is one of them, and poor facilities. Dr. Emebiero also dwelled on the reason for living, and he took School of Basic Medical Science as a reference. His job dissatisfaction and discrimination, that if this is taken care of, it will at least ameliorate the situation. And he specifically said that there should be multidisciplinary collaboration to help ameliorate this situation. Dr. Osigbe said that government cannot do everything. I wonder what they are doing. Government cannot do everything or do it alone, but they provide incentive for private sectors, and that health insurance currently should be strengthened. Unfortunately, Professor Hugo said that health insurance is a debtor. So, if we look at health insurance, everybody pays, and I know I pay every month. Where is the money, sir? So, improve infrastructures like telemedicine that will help people, diaspora professionals, to help those here. That will also improve the situation. Diaspora professionals should be encouraged to come back, and currently in UBT they are trying to do that, but funding is a problem or a challenge. And he also capital to say that medical service is a business and it should be regarded as business. And lastly, health professionals should be encouraged to delve into politics, according to Dr. Osebe, so that we will be able to handle it from that sphere. Unfortunately, somebody was there in the last dispensation. What did he do? Thank you.
Give room for a few comments or questions. If you want to ask questions, only one. Please, let's take two, Mr. Provost. Professor Dayanfo and Professor Eddie Kamena.
The chairman of this session, the provost, senior professors and deans, senior professors and professors, ladies and gentlemen, indeed University of Benin students. The matter we have discussed now is very pertinent. On the one hand, one will want to think the people we should be talking to, are they here now? On the other hand, I will want to say that the people are here. Because I want to tell you that the changing this country, changing the status quo, retaining doctors, attracting those who have left, we start with all of us. Most of us are not truthful. Most of us are psychopaths. I argue, ferociously. Why do we try to change what happens at Ring Road? Why do we try to change what happens at Abuja? When under our nose, worse things happen and we keep quiet? A doctor died in Lagos in an elevator, and we have it on good authority that everybody in that system was aware an elevator was bad. Nobody will talk to those who are responsible prepared to remove sentiments, to remove nepotism, to remove favoritism from our activities and actions, the healthcare system, the educational system will not move forward. We must be prepared to tell ourselves the truth, and to explain that we build new buildings, no light, no water, and some buildings are commissioned under our nose, and we are clapping for the CEOs. These are fundamental questions we need to, we need to label in our minds. So, if we want to change the system, it starts with all of us. Thank you.
I want to appreciate the last speaker because eventually took the word out of my mouth. But I will amplify what he said. We are not being dishonest, it's not pretending. We can say what we want to say. At government level, at non-governmental level, at individual level. For years, I did the work of a servant in UPTH, another hospital. What did I get back? I have all the letters and documents at the right time. I will share those people who wrote those letters. Not now. Not at all. So we have vicariously liable. Every one of us vicariously liable. Let's not pretend. Because first and foremost, we have to detoxify ourselves of that commander position. You are holding position of a CMD or VC and you think you are too much. When I, as a non-professor, have taken home university management out of this country more than 3 times to go and see people, I want to see you and know that you are making your shoulder. Who are you? We have to detoxify ourselves of our ego. You have to encourage other volunteers. If you don't, there will be crisis. Because for me, I have full of ideas. I can navigate almost anywhere in the world. I know so. Canada alone. Insecurity we are talking about. You ask yourself, which university in Nigeria addresses insecurity? Mention one university. Mention one. Some of us are in the accreditation committee and all that. Some of us are still in school of agriculture doing medicine and we are like to stand. Doctors will go to Federal University of Agriculture doing medicine and they will like to stand. Their anomalies are endless. I can go on and on. If you think this sector is not concerned, you want to attract other people from outside. I know a doctor that came from Port Harcourt some time ago. They kidnapped him twice. Undule came to this place. Undule was one of the foremost doctors in New York. When he came, he was wasted. He was there. I want to encourage you. Wow. When you hear one doctor is killed, what happens to you? Even though people you are bringing right now for that period, you better provide security for them. Otherwise, you're going to be in trouble. NUC itself is even the heart of hypocrisy. I told my friend NUC, they should stop those idiotic programs saying we are going for accreditation. Then every VC we line up, we have this, we have that. Then we give us one envelope. We go there for 2 months, 3 months. Then after that, we tell you to go. I was a visiting professor in Admiralty University. I thought they were genuine. I don't know that they were playing the same game, using me as a scapegoat. When the head of the place to assess the DNA lab and others came, I was shocked. Who was head of the place? I don't want to name him for privacy. One, he's a retired professor, 70 plus. 2, he's a computer scientist. He has nothing to do with even forensic DNA. He was the one coming to analyze or to assess what was happening there. And we accept the result and move on. Do you understand? So the message should focus right now on futurity courses. Are we ready? Please, I wonder, are we ready to focus on futurity courses? You are heard of Taiwan. Taiwan has no oil. No oil, nothing. Just for the sake of microchip and semiconductor, we they control 65% of the world. They rule the world. That's why China and America are battling. What is Nigeria known for? What are we going to celebrate? What are we celebrating to celebrate? So let's tell ourselves the truth. Even when we are ready to do the needful, we have our belief for each other. That petty jealousy. Oh, I'm in charge. How can this one be doing this and so on? Please, I just sat there because I want to vent my anger and go away. Thank you very much.
let me stand on the existing protocol.
We'll come out to you.
Who is the agent that want to speak for?
Who is the young lady?
They want to speak for.
You want to vent your anger.
Okay, good afternoon, everyone. Professors, medical students, doctors, lecturers. I'm Esther Morigi. I'm a medical student. So, concerning the many points discussed, the person I actually want to talk about was the evaluation from the point of government, whether what government thinks about recruiting people and why the embargo still lingers. Mentioned something about people thinking about people bringing their relatives into the place of offices and assuming different roles. While we can see all of those challenges, we cannot solve them. So they cannot be like a strong point for government to still look at every time, because these things are inevitable, whether or not we like it. So there are considerations that should also be factored in when we are thinking of solutions. We're not thinking of how we can totally stop people from bringing their own persons. Although it might change over time when people tend to value competence, but it should not be a reason why what needs to be done should be hindered. Also on the level of training people, and what can be done to encourage those who are training. If truly the people who are training others are not encouraged, there's no way they can give what they don't have, honestly. They are discouraged doing the work, and there's a lot of encouragement that can be communicated to these students. And mention something about including our curriculum, something that genders government in medicine and entrepreneurship in medicine, knowing that medicine is also a business aside being a social service. If it can be included in the curriculum, it means that it's going to really be a multidisciplinary approach, because we cannot say because it's medical students we must get doctors to teach them government. We cannot say because it's medical students we must get doctors to teach them business. We need people from everywhere. Now, talking about artificial intelligence in medicine, now we cannot use doctors to teach artificial intelligence, because we're going to need people from other fields that are well versed in this field to also make sure that we know these things. Because if we talk about just having doctors everywhere, when we look at the place of government, we're so surprised that even among our senators, we have doctors there. Okay, even among our senators, we have doctors there, and they cannot rightly communicate what people are passing through as doctors who are practicing in the hospitals. And finally, talking about overworking professionals, I think you mentioned something about human resource for health. I think they need to actually do so much better in that aspect, because some people are preparing for their exams to run away, and in a bid to do that, so many people are not really functioning in their offices. They're like, oh, I have an exam, I hope you understand, and they're not working, and they're leaving the work for those who are not so privileged to be able to write the exam at that point in time. So you just see that you understand I'm writing the exam, so you will not just be like the bad belly in your matter. So you just say, okay, I understand, you're writing the exam, and then the work is now left for a large number of persons to do. So if they work on human resource for health, they understand that human beings are not machines and they have their own capacity to work. They will not see the need for them to employ more persons when you know that this person has a work capacity and limit at which can be done. Thank you very much.
Thank you very much. That was a very, very useful contribution coming from the people who this talk is actually meant for. But for some of us, the japa is not for us. Yes. Now, you can perceive frustration from the comment by Adeyapo and Professor Edi. And that is how everybody feels in this country right now. Immigration is not new. It's been there. When I was a medical student, there were people who went to the UK. Some stayed, some came back. They came back because the country was stable. They were coming back to meet Yes, I remember when I went for my first laparoscopic training, 2008, in India. Before I came back, management has procured laparoscopic equipment. So it didn't take me time. Now, it wasn't the president that came to procure that endoscopy equipment. It was the CEO. There are so many things that you see, the government has a responsibility to provide, to protect life and properties, social welfare services, education, housing, and then improve on infrastructure. We have policies in this country. We are not suffering because there are no policies. There are. But the problem is implementation of those policies. The CEOs in this country are responsible. Government agencies, what do you call MDAs and their heads, they are the problems in this country. That is the level of implementation of policies. They are not doing it. We say, I was in management of the university for a while. For almost 8 years, no employment. Lecturers were not taking. Lecturers were leaving. But the vice chancellors kept quiet. Because you cannot argue with your boss. If your school is still running, and you are complaining that there are that we don't have lecture, then how are you doing it? Just a minute. We go out to do accreditation. Lecturers go and do accreditation. And we say, the school is okay, we accredit them. And then at the same time, we go and tell government that we don't have infrastructure. People who do accreditations are lecturers, ASU members. Now, the last thing I want to say is this. I'm not here to discourage anybody from travel. After all, I have children now that are at the risk of traveling. Yes, but you see, I always tell them, for those of us who can afford to, when you are going out, take 1 or 2 of your children, spend a week or 2 weeks, and come back. Let them also see that side. You must consider the good, the bad, and the ugly. People who are there don't tell us all the stories. Here in this country, why do people, after graduating, they just want to travel? I have some staff that have worked in my private clinic for 10-15 years. But if you ask them now, do you have a job? You say no. But you have used that work to marry. Now you to train your children in school. But you say no because you are not employed by the government. Everybody looks at it. When you travel abroad, all these people who travel abroad, how many of them are employed by the government? So the government and big multinationals are the only employers that are recognized in this country. And in my clinic, I have staff there that do other jobs. I tell them, I have no problem as long as it does not affect your work here. You cannot stay in one spot, a salary earner from one source, and you think you will make ends meet. Go abroad, they do 3 jobs, they do 4. So how can you close from work by 3 o'clock, start watching television and reading newspaper? We're increasing the frustration here, and every time we put it back to the government, and the government is responsible. We should try and engage ourselves more. We engage ourselves, you discover that Some of those things you are running to look for outside, you can get them here. Government will play their own role. Besides, one thing I always tell you, sincerity of purpose. And let us be content. There is a reason why those who develop cars, there is Volkswagen, there is, there are different grades. There are different grades. There's Nissan, now, you see these big cars are supposed to be cars for CEOs. You see that sunbed is so small. They were dividing meat. He said, let my own be very big. How big are you? We are content. If we are content, some of the things that frustrate us in this country will not frustrate us. Yes, sir. Thank you.
Thank you very much, Professor Azike. With that last comment, we don't really have any question for the panelists. We want to thank all the contributors to this session. We have come to the end of this session. Thank you very much.
Thank you very much. Please come put our hands together for the panelists on that plenary session. Strategies for retaining and attracting healthcare professionals. For some of us, I'm sure this was one of the most practical aspects of the conference that we could relate with. The JAMA syndrome, the causes, and possible remedies. Please, one more time, let's put our hands together for wonderful panelists. Thank you very much. And this is how we'd like to welcome you to the concluding part of the first scientific conference of the College of Medical Sciences, University of Benin. First, I'd like us to make welcome to the high table this week. There are plaques for you. All panelists, please come on stage. Thank you. Please come on stage. I'd like to welcome the Provost College of Medical Sciences, Professor Wilson Sado. He's already here standing. He's meant to take his seat at the high table. And then the chairman of this very session is someone who just received his comment, or former Deputy Vice Chancellor Administration of Outreach University, Professor Michael Azike. Please take your seat at the high table. Please, let's clap very well to celebrate them. These are, intellectuals, and I'm sure that you enjoyed the comments that came from everyone. Okay, panelists are here. The plaques, please. Okay, the chairman of this session, Professor Azike, you're going to be making this presentation. Okay.
Alright, so let's have the first one for Professor Kudu. The organizing committee prepared class for the panelists, but they done very well. I think they did very well. So the first person to step forward was Stanley Okubo. Present this to you in appreciation of your brilliant performance during this session. Congratulations. Professor Sonny Okegweme. Professor Sonny Okegweme, on behalf of the Provost, College of Medical Sciences, the LOC for this conference, we present this plaque to you for the performance of this session we just completed. Congratulations. Dr. Inojara. Yes. Dr. Adaze Inojaro, on behalf of the Provost, the LOC for this conference, we present this plaque to you for your wonderful performance at this session. Last, certainly not the least, Dr. Omosigo Izadoden, ably represented by my medical friend, Dr. Segbe. Present this plaque to you on behalf of the Provost of College of Medical Sciences, the LOC for this conference, for your performance at this session. Congratulations.
Thank you very much, Professor Clement Osime. I'd like to especially congratulate all the panelists, Dr. Efoma Sewe, Professor M.A. Mokpai, Dr. Adaze Inojaro, Professor Sonny Okegweme, Professor Stanley Okubo, Dr. Mosigo Zedome, and of course Professor Sime. We thank you very much for making up that wonderful panel. Thank you. I'd like to quickly recognize the present. Everyone, please, you're welcome, you're recognized. I just want to quickly recognize in no particular order. Dr. Amina Okaku, DCMA Clinicals, UBTH. You're welcome. Please, when we are clapping, let's clap very well. Thank you. This is a scientific conference, so our clap should be scientific. Also like to welcome Dr. Eki Udoko Fidelis, DCMA Training and Monitoring. We welcome you, Professor Wilson Yosarbiago, Dean, School of Medical Sciences, University of Benin. Professor Agoreyo, we welcome you, sir. You're welcome. We also welcome you, Professor Edi Ehiameno, Director of Studies. We also welcome you, Dr. Igiato Adeyonfo. We welcome also Professor Clement Azodo. I will now invite to the microphone the Provost College of Medical Sciences, Professor Wilson Sado, for his remarks.
Thank you very much. The chairman of this occasion, former BBC academics, Professor Michael Aziken. I must recognize before I close, so that my house will be peaceful, I must recognize the deans and directors that have worked with me since I assumed office. First, the Dean of Medicine, my namesake, who is in Osarijago. Thank you very much. There's the Dean of Dentistry. When they are calling names, you should be present. But I want us to clap for him. He's a fantastic man. Next is Professor Agoreyo, the Dean of Basic Medical Sciences, who has a lot of work to do to reconcile basic medical sciences. The Director of the Institute of Child Health, Professor Ibosado. I like to quickly acknowledge my friends and heavyweights on the hospital side, the DC Max. I can see them seated close together there. I'm now happy. My friend and brother Fidelis Ekidoko, thank you very much for coming. I also quickly want to acknowledge the Director of DNA and Forensic Sciences. I hope he has calmed down now. you remember a while ago, was very angry. And of course, our big brother, the center leader of SERI, even though he's not here, we would also like to acknowledge them. These are the components in the college. I'm so grateful to my lieutenants because when I came on board, one of the things I wanted to do was to assist every unit, every department in the college to grow and to get to whatever height that you want to get to within the limits of legalities, you know what I mean. Incidentally, that was something I said a long time ago. I also said that I wanted to increase the academic activity within the college. And one of the things I was going to do was a college conference because I felt that we were ripe to have a college conference. At that time, a number of things ran through my mind. One of them was that how was the people going to receive it? And these hard times that people are thinking of the next meal and considering whether they should japa or not japa, would they be interested in an academic conference like this? And so many other things that came up. It occurred to me, having been involved in running conferences, national and local conferences before now, it costs money. If you have money, you can sit down in your house and run the conference. If you don't have money, you will run helter-skelter. All the time, your mean heart rate will be in the range of tachycardia. And at night, you won't sleep well. So I thought to myself, do I want to take that on? But again, my lieutenant encouraged me, they were happy with the idea, and so it started. Then we were blessed with the deputy provost, the person of Professor Vivian Mwembo. Can we clap for her? I had approached a couple of friends to chair the committee. They had declined, and I didn't blame them. So many other things to think about. And I said, well, why should you go too far off? Let the office of the deputy provost be in charge. That way we can rub minds and we can also have some measure of control over what's going on. Luckily for me, this great lady caught the vision and ran fantastically with it. The rest of it is history. She wouldn't expect me to say this because she's a very private person, does not want anybody to say things about her and so on. But you can't perform like this and not expect somebody to say good things about you. So I want to thank you so much for the effort. Know that you are willing alone just brings things to happen. And I want to particularly thank my deans and director urging us on. No, don't worry, it will work. I know that at the beginning that there were people who thought it wasn't going to work. And by their actions and all of that, it showed. Now some of them even forgot that they were in the committee. Yes, I will have to be calling somebody. You have not registered. You are a committee member, you have to register and so on. But having happened, I know now that you believe and that you want to make the next one bigger than this. I have heard comments, very encouraging comments from members. Oh, the next one I want to be involved actively. I like that. And then looking at the scientific sessions, I sure you will agree with me, they were very rich, and of international standards. We had very beautiful presenters, very beautiful presentation. I remember the opera one, and of course a bit of opera in room 2, room 1, yes. We had said at the beginning the objective was to showcase what we have and how we were going to impart our own world in our own field, in our own craft, the things that we are doing in the college and how to bring this to bear in our clinical practice. I think we have started. We have started very well. Again, I must thank the CMD and I will urge you, with the new spirit and new attitude, we will continue to create an enabling environment for the healthcare workers within the college to have a place in the hospital where they can learn and practice their arts and practice their trade. Is that okay?
Yes, sir.
I would also, at this junction, quickly recognize the wife of the CMD. You deserve a very special place because you've been here with us. She's been here with us from the very beginning. I think she even made a presentation. Thank you so much. Your husband was supposed to make a presentation. Those in Abuja pulled him away. It was an internal japa, but we understand. Finally, I would like to say I enjoyed myself. And I hope that you all did. And we must thank our students to see some of the students make presentation almost flawlessly. I said, look, there's capacity and there's hope in the College of Medical Science, University of Benin. Until we have something like this, you really do not know what you have. Now, let me place this as a teaser before I pull the curtain on this one. Today we're going to be giving out awards. Best abstracts, in various schools in the college. For the best abstract in the college, it's going to be a bragging right to the next conference. We hope that this will encourage us to go back and think of impactful work for the next conference, so that when you come, we also like to hear you, and then you can take over the bragging rights for whoever gets it today. I don't know who has. I am not involved with that. But I'm keenly looking forward to it. Which school is going to grab it? Which school is going to grab it? Well, I finally like to thank everybody, thank the various schools. Basic Medical Sciences, some wonderful people there. Professor Mogba, your contribution from the beginning to the end is acknowledged. People like you must be acknowledged publicly. I know you are another quiet, private person. You stood for the basic medical sciences like the Rock of Gibraltar, and I appreciate you for that. We hope that Department of Nursing will join us the next time around. They are the only department where we didn't receive any abstracts. We hope too that they will register. I will speak with them. Let us work together as a College of Medical Sciences. Thank you, God bless you.
Thank you. Does the provost not deserve another round of applause? Thank you. And so, before we receive the next program of the next item on the program, I'd like to introduce the Public Relations Officer of the University of Benin Teaching Hospital, Mr. Joshua Owaila. We are going to be handling this second session together.
Good afternoon, the Provost, the Chairman of this closing ceremony, Professors, Deans, and delegates in this very auspicious conference. Provost, I must commend you for this initiative and the entire university, because if there is anything that the Ivory Tower should be doing is providing solution to topical issue, and the University of Benin is taking this issue of brain drain by the horn, and I'm trusting that at the end of this conference, the recommendations that would have come out will move this country forward and help us. Otherwise, what can happen is not something we should look forward to. We'll be at the mercy of the Yabi Taishes of this world, the Balogun generals of traditional medicines. But we hope that by the grace of God it won't come to that. Thank you very much, Provost and the authority of the school. Right about now we'll call on the chairman of this closing ceremony, a former Deputy Vice Chancellor Admin of the University of Benin and the Director of the HRRP program in the University of Benin Teaching Hospital, Professor Michael Azikian.
The Provost, Deans and Directors, Eddie, Let me specifically acknowledge the presence of one of my, he doesn't know he's my very good friend, but he's my very good friend. It's not you. It's a good radio. Now, every good thing has a beginning, it also has an end. We are the closing ceremony now. Thank God I was here at the beginning, and I'm here to witness this hour. Before we close, I think I must request that we all give the provost of College of Medical Sciences a clap offering. But I'm going to direct the clap offering. You will clap with the movement of my hand. No? Clap with the movement of my hand. Very much. Now, this is the maiden conference that this college is organizing. It is not a small feat. And for those of you who presented here, you demonstrated something. That your presentations were genuine. Because the people who work with you listen to your presentation. There's no way you can doctor it. Somebody will challenge you from the audience. Looking at all the papers that were presented, these are quality articles that cut across all the faculties and departments that make up the College of Medical Sciences. The attendance, I can tell you, is impressive because this is the first time. It's very impressive. I understand that so many persons join on Zoom. Thank God for COVID. Otherwise, nobody knew about Zoom before COVID. After my speech here, somebody sent me a message. Was it a speech? After my comment, he sent a message. Say, that was a good one. So I started looking for her in the audience. So I now called. Where are you seated in the audience? He said it's in Abuja. So whatever we're doing now is being watched all over the world. So this is a very good beginning. I want to encourage the provost. Thank God this is your first year as provost. So we're expecting, how many more before you leave? 5. We are in an era of 2 terms. Except you want to terminate this term and go elsewhere. I don't know. You know what I mean? So, in next year, it will be bigger and better than this. This is good. But next year, we are hoping for a more and more exciting outing. The masquerades will come and present. The big masquerades will come out like that. So once again, the panelists for today, I thank you all for coming. You did a great job. This country is our own, and we must try to get it better and better. Nobody will do it for us. We do it ourselves. At times I look around, I see people that have the capacity to relocate and live very comfortably abroad, but they are still here. What does that tell you? There is hope for this country. There is hope for citizens of this country. So, ladies and gentlemen, let me have this microphone over to the PRO. Which of them now? PROs. So that we'll go on to the next stage of the ceremony. Thank you very much.
Thank you very much, sir. Now, the one-time Deputy Vice Chancellor Academic of this great university. I must confess, this conference, I am so impressed. A lot of times we get involved in the business of, co-partnering with departments and units, organizing programs. But for this, I want us to put our hands together for the organizers. They've done a very good job by our assessment. Thank you very much. So on that note, I'd like to call on the Deputy Provost, College of Medical Sciences, University of Benin, Professor Mrs. Vivian Mwebe, for the coordination of this award. Please put your hands together to celebrate her very well. Keep clapping until she gets to the microphone.
The chairman of this occasion, my teacher, Professor Michael Aziki. Thank you for coming. The Provost, College of Medical Sciences, my boss, and our senior colleagues, very senior colleagues here present, deans and directors, great university students. Great. I'm sure you agree with me that this is time well spent. I think so. So now we are at the hallmark of the conference. We said we're going to have presentation of awards. So, but I can tell you that we all did very well. We had 52 abstracts were presented, submitted, and presented. Just a few people present. So we're going to have different categories. We have judges. None of you knew who the judges were. I was the only one who knew. I was not a judge. The judges know themselves, and no other person knew who these judges were. But I can say that it was a tough competition. The scores were quite close, but we can't give everybody an award. So even if you don't get an award now, like the provost said, it means that you start planning that special research that you want to showcase next year. All right? Thank you. So we have different categories, like I said. The first category we are going to call are the undergraduate students. I'm sure I don't know how many of us were at the presentations yesterday morning. I think most of them presented yesterday morning. These are 600, they are in between. They've actually graduated, but they are not, they've not been inducted, right? So they are in between. So we decided that for that category, we are not going to, we score, but we're not going to give first, second, third. The 10 presenters are all going to receive an award. Because it was to encourage other undergraduate students. So I'm sure next year, more undergraduate students will want to be part of this to present their papers. So I will call on, I'll call on the Director of Institute of Child Health to be the one to Okay, so this award for this medical student, undergraduate medical student, is actually for presenting their papers and participating in this conference. So
Professor Ekwere. Come from one side. Come from that end. Osakwe gift. Osakwe gift. If you know you presented yesterday morning, just line up, find out. Yes. Uyosa Osaemida. Please come on stage quickly. If you presented yesterday morning, please come up stage. Find out. Thank you. You come down this way. Use the stairs. Now. Ioha, Jessica. Please take the stairs down. Take the stairs down. Jessica Ioha. Please find out if you presented yesterday morning. Benedicta, action.
Schools and the resident doctors, because they're also postgraduate students. So we will call Professor Eddie to help us with this award. But you will get your awards. Okay. A penny, and Ume. Please, I don't know if you are here. Just stand up for recognition. Okay, they are not here. Okay, don't worry. So we will send your awards to you. Please pardon us. We didn't know you were private students. To the schools now. So we have the Institute of Child Health, the School of Medicine, School of Basic Dentistry. Dentistry and School of Basic Medical Sciences. So if those schools or institutes had one or two abstracts, we felt that every school should be represented. So we will start with the Institute of Child Health. I will call on Professor Enopai to present this award. So the best abstract presentation from the Institute of Child Health goes to Professor Ayebo Sado. So we have only one. So the best abstract presentation, I will call on the Dean, School of Dentistry, to give out this award. Is from Dr. Emeka Odai. The school, Professor Adorable, please. So the second runner-up is Dr. John Anioye. Exam. Okay. The second runner-up is Dr. Iria Gonse.
Sciences, University of Benin, I present to you all, Group C 500 level medical students, this award of excellence. At the first annual scientific conference of the College of Medical Sciences, I must add that you people were awesome. The college is grateful. Congratulations.
everybody here present, starting from the provost who gave us the opportunity to have this event or division, the deans of the different schools and the director of the institute, very senior colleagues here present, UBTH management team, other lecturers, academics, non-academic, and academics here present, undergraduate students. I know they are not just medical students here. Thank you for being part of this conference. We hope that next year it will be better, just like someone said that, okay, the chairman said that this is just a peak. So next year we pray it will be better than this. And so please, when we call on you to serve on this committee, please oblige us. Thank you very much. Thank you.
Thank you very much, the Deputy Provost, College of Medical Sciences, Professor Vivian Omoemo. We'll now take the Unibet anthem and then the second stanza of the national anthem. Please, there will be group photographs outside of the auditorium. Thank you. Please let's be upstanding. Thank you very much.